Good morning and welcome to this Facebook Live with Avant Healthcare Professionals. It is great to have you with us this morning, and so put in the chat, let me know where you are. We are here in beautiful, slightly cool but sunny Florida in Orlando at the Avant Healthcare Professionals headquarters. My name is Lesley Hamilton Powers, and I am the Senior Vice President of Operations, and it's my absolute pleasure to spend a little bit of time with you this morning to talk about how to get hired by a U.S. facility and how to pursue your passion, which if that involves the U.S., then you are in the right place this morning. Renier Vista, what are you doing on here? Lovely to see your name. We have people from the Philippines, from Harare, from Kenya, from Saudi Arabia. Wow, that's amazing. So great to have you all with us this morning. So I wanted to tell you a little bit about me first of all. I'm a registered nurse by trade. I've been here at Avant for 15 years, but I started like you as a registered nurse, and believe it or not, that is me. I think I was probably about, I don't know, maybe 3 or 4 there. So you can see that healthcare for me was something that started at a very early age. I did my nursing training in New Zealand, and shortly after that began to work in the oncology field, moved to the ICU before coming to the States, which is now over, oh my gosh, it's got to be about 25 years ago. So I look really young, but I'm actually quite old. So that was just a little bit about me. And as I say, I've been here with Avant for 15 years, and I have the pleasure of being responsible for pretty much all of the departments that you will work with if you find out that Avant is the program for you. And so that includes recruitment and licensure and immigration and client services, as well as employee support. So lovely to see you, Crystal and Jane from the Philippines. So let's get started and talk about pursuing your passion. So for me, the US was a passion for many reasons. One, to be honest, was that I did meet a boy, and he happened to be from here, so that had a lot to do with the initial decision. But it really is important for you to consider your why. I've been thinking about my why in my life as I think about the next 10 or 15 years that I have in business. And it's really important to connect with that why. Why would the US be an option for you? Talk to me in the chat a little bit about your why. If you are going to come to the US, what is the reason behind that decision? Because it's really important. On the days that you wonder why on earth you did this, why on earth did you make this decision, connecting to the why will be really stabilizing and will bring you back to the reasons that you thought about the US in the very beginning. And those of you overseas, you know, you're now in that process. You should be in the process of thinking about the why. Is it because of opportunities for your family? Is it because of financial opportunities? Is it like me? All the research I read about nursing and nursing practice came out of the US. And so for me, I wanted to experience that opportunity. So tell me a little bit about your why. So what I would strongly encourage you to do is do your research. There are so many options that would bring you here to the US. Lots of great opportunities now. So we really want you to do the research, look at different companies, look at different options, find out, research about what do you need to do for the NCLEX? What do you need to do for the IELTS if that's applicable to you? What do you need to do? How does the immigration process work? And look at all of those opportunities and then find the one that works best for you, the one that connects to your why the best. I'm not seeing any whys, So let me give you just a couple of minutes, a couple of seconds to tell me about your why. Who's going to be brave enough to tell me about their why first? So what is the reason you are thinking about this opportunity? What is the reason the US is the one for you? And again, make sure you do the work. Make sure you do the research before you make that very important decisions. Thank you, Steph. Better life for your family. That's something we hear a lot of. And there are many opportunities for family, for spouses, for your children, for your extended family back home. We know a lot of you send money home. So this move, for some of you, also helps your family. Maybe you were the one that somebody in the US paid for your school. And now it is your turn to pay that forward and to pay for school for the next family member that is coming. Lots of activities, lots of great activities. I pursued my passion of skiing. Haven't skied in a long time, but used to love to ski. Got to do that here in the US. Have gone on lots of cruises, seen parts of the Caribbean, seen parts of Alaska I never would have seen. And again, career growth, great why. Thank you for sharing that with me. Better standard of living and comfort for my granny. Grannies are all important, so definitely a good reason to think about that. So thank you for sharing that with us. So let's move on and talk about what is the education you need in order to be able to fulfill this goal that you have of maybe coming to the US. Obviously, the bachelor's degree in nursing is always something that is preferred. Many hospitals require a bachelor's degree, but we are happy to say that we also consider those of you who do not maybe have a bachelor's degree. I don't have a bachelor's degree. I have a diploma in nursing from New Zealand, a 3-year diploma, and I made it through that process. So certainly associate's degrees, diplomas in nursing, and obviously the BSN. Now, one of the things I will let you know, and I get a lot of inquiries on Facebook about this, can midwives apply? Now, if you are a midwife and you do not hold a general nursing license, unfortunately, there is not a pathway through the NCLEX for you to be able to come to the US. I get a lot of questions about that. It's not that we as a country don't need midwives, we do, but unfortunately, because you do not hold that general RN license, it makes it very, very difficult, impossible in fact, for you to go through that, the NCLEX process to come. Also, those of you who only hold a license as a registered mental health nurse or a registered pediatric nurse such as the UK, you do need to hold that general RN license acquired either through a bachelor's program, an associate's program, or a diploma program. And all of those programs would be verified as you join the program here at Avant. So let me know if you have any questions on education. We're going to talk a little bit about experience now, but I want to answer any questions you may have on the experience, on the education side of things. Now, I see a question, are we recruiting home care? I'm going to cover that in just a moment. So from a clinical experience standpoint, it is really important. Hospitals here are looking for experienced nurses. The biggest gap in the staffing here in the States is for those nurses who have between 2, 5, and 7 years of experience. We still have lots of grads. We have new grads graduating multiple times throughout the year in the US. But the nurses that clients are looking for are those nurses that have that 2 to 3 to 5 years of experience. And so it really is important that you're gaining experience before looking to come into the US. Nursing in the States, although there is a lot of similarity to what you know at home, is also very different and can be even more challenging. So really important that you are working at least 36 hours a week, and that you have that 12 months of all-important postgraduate nursing education. Now, there are programs out there that will take you with less experience than that. My advice would be get that 12 months of postgraduate experience. When you first come out of school, you have all the theory, you have some practical experience, but super important to really build that foundation of application of the knowledge that you've learned in school and turning that into that 12 months of postgraduate experience. So that's certainly what I would recommend. So let's take a little bit of a look at some of these questions. Some of these may be answered. So NICU, yes, I'm really excited to tell you that we are now taking both NICU, PICU, and pediatric nurses. We did not take peds and NICU for a long time. There was just no jobs. But many hospitals now across the US and many companies now are entertaining NICU nurses. So we have a question from Maggie. Maggie is saying, I'm a registered nurse midwife. I did my general nursing training for 3 years and later did midwifery for 1 year. Do you qualify? Yes. Good news is you have that RN program for 3 years, and now you have that 1 year of midwifery. So you would definitely meet the requirements for licensure in the United States. Can a diploma in general nursing befit the NCLEX setup with Avant for recruiting? Now, not only Avant, but if you have a 3-year program, in most cases, you will meet that requirement. One of the requirements here for licensure in the US is that you have done clinical and theory in your nursing program in medical, surgical, pediatrics, obstetrics, and psychiatry. So if you have a general license and you completed a certain number of hours in each of those 5 areas, chances are you will certainly meet the requirements to be licensed here through the NCLEX for the US. We, as a company, and many companies do this, may ask you to verify your education. We want you to be not disappointed. We don't want to get through the program and then you find out you're not eligible. So Avant and many other companies that recruit for the US will also verify your training should there be any question about that. Now, I did see a question swing by for a registered mental health license. Again, if you are only holding a license as a mental health nurse and not a general RN, then the US at this time would not be available to you. And so you would need to go back and do a general registered nursing program. All right, so let's talk now about what are clients looking for from your background. Now, there are opportunities across the US from little 25-bed hospitals to big hospitals of 1,000 beds. And so there is a lot of opportunity now for nurses seeking that move to the US. But ideally, you should be getting experience in acute care. There are more and more opportunities in subacute care, and we're going to talk about that in just a moment. But if you are looking for a job in a hospital, you need to be working in that acute care inpatient setting. Ideally, that hospital should be somewhere in the region of 80 to 100 beds at a minimum, okay? So we do consider, and other companies may consider, hospitals that have less than 80 beds, but that sweet spot is that 80 to 100 bed tertiary or secondary level hospital. So bear that in mind, particularly if you're graduating, maybe you're not out in the workforce yet, look for that 80 to 100 bed tertiary or secondary level hospital. That's really going to be what's going to stand you in great stead. So let me just take a little bit of a look and see if we have any questions related to that. Currently working as a medical surgical nurse. Jen, absolutely. One of the biggest needs here in the US is for med-surg nurses. Are there any exams one has to take apart from the NCLEX exams when we arrive in the US? Well, the good news is when you arrive, all of the exams will be done. There really are two main exams, and we're going to talk about those, the NCLEX and an English language exam. Let me see. Do you have placements for public health? That is not an area that we currently have opportunity in. It's not something that really becomes available for international nurses. There are public health opportunities here in the US, but often those are filled by US nurses. And obviously for companies to be able to provide an opportunity for you to be coming into the US, there needs to be a need. There needs to be openings that we need to fill with international nurses, and public health does not seem to be one of those. If I have 5 years of experience as a general pediatric nurse and 12 years in a PICU, then I would certainly recommend that you consider applying again. How about psychiatric nurses? Again, if you hold a general RN license and you are working in the psychiatry area, yes, there are psychiatric opportunities. It is just if you hold that license as a registered mental health nurse only, that would not allow you to come into the US. Okay, so let's move on. There's lots of opportunity coming up in home health. It's a relatively new area for international nurses to take part in, but there are multiple opportunities becoming available in home health. Home health is one of the fastest growing areas of nurses in the US. There's pressure on hospitals, obviously, and so people are being rehabbed in their homes, post-surgical care in their homes, IV infusions in their homes, chemotherapy is being delivered in patient homes. And so it's exciting to see the growth of that area. Now, in home health here in the US, it is not equivalent to that private duty care that we see in some countries. You will see somewhere in the region of 4 to 6 patients a day. And all important, in order to be a home health nurse, you need to know how to drive. And so that is a skill that if you don't already drive and you have interest in working in home health, I would start learning. Start learning how to drive so that this wonderful area of nursing is open to you. So again, for home health, most home health companies are looking for the fact that you have around 2 to 3 years of experience by the time you are coming into the US. Now, you also can apply for home health if you don't have home health experience. Those skills that you gain in areas like medical surgical, critical care, sometimes in the ER, those are skills that you can use in that home health setting. Lots of wound care, lots of assessment, lots of education in home care, IV infusions, blood taking skills, what else do we, cardiac experience. Lots of patients who need home care have cardiac conditions, have lots of comorbidities, maybe have had surgery and they are rehabilitating in the home environment. So it really is a wonderful new opportunity that is becoming more and more available. Also exciting to say that nurses with polyclinic experience can be considered for home health. Many of you are working as clinical educators. That is also experience that we can consider in the home health arena. So it really opens up opportunities for nurses who may not be working in acute care to have an opportunity to come here to the US. So let me just take a pause and have a little bit of a look here. Any space for CNAs? So certified nursing assistants, nurse aides. Currently, there is not a visa that supports us to be able to sponsor nursing assistants CNAs to come into the US. I get many questions on Facebook every day from nurse aides, nursing assistants wanting to come into the US. At present, that is not an option. You know, I wish I had a crystal ball some days where immigration is concerned, but right now, that is not something that we are able to assist with. My recommendation would be maybe think about nursing school. Maybe think about going and getting your RN qualifications. And you could be here in just a few short years. Big commitment to do that, but if the US is your goal and your passion and your why connects to that mission, then maybe think about nursing school. We need more nurses. All over the world we need nurses. So it may be something to consider. Let me take a little bit of a look here. Marita, if one is presently working in general pediatrics, but worked in med-surg for 2 years, can they apply? Again, definitely we have pediatric openings. Sounds like you might be eligible for consideration. Let me see, do you offer opportunities for registered community nurses? Again, that would be more likely to be in the home health arena. If you're currently working in community health, I would certainly recommend that you look at an application so that we and the company maybe that you decide on can take a look at that experience. So, how long does the entire process take for an international nurse? Great question. It can vary. It varies depending on whether you have NCLEX already or whether you need NCLEX. And we're going to cover that in just a moment. All right, let's keep moving through the slides. So when we look at hospitals and we look at nurses who are seeking that move to work in a hospital here in the US, we have, and the needs really are across the inpatient settings. Things like intensive care, lots of opportunity with COVID, with the rise and fall of COVID cases. Critical care nurses definitely have been in demand, particularly those with experience of respiratory cases, COVID experience, competency with ventilators, critical care monitoring, cardiac drips, those kinds of things. CVICU is also cardiovascular intensive care, one of the highest acuity areas of nursing here in the US. So critical care, definitely an area of need. OR, even through COVID, when OR elective cases were closed down, there is still a strong need for OR nurses. What I will tell you though is that you need to have really good diversity in your cases. One of the reasons that nurses who are working in the OR may not be accepted for a program for the US is because your case diversity is too narrow. So really important that you're getting good general case experience, orthopedic experience. If you have a specialty, orthopedics is the one to have. Orthopedic OR is a very big revenue generator for hospitals here in the States. So if you are going to have a narrower skill set, orthopedic OR is probably the one I would say that you would have. So let's do a question. How long have you wanted to move to the US? Less than a year? Between 2 and 5 years? Between 6 to 10 years? Or your whole life? Wow, that would be quite something. So let us know your response. So some of the other areas that we're looking for. The emergency room. There are lots of opportunities for the ER. Some of those opportunities exist within that hospital environment. Some ER experience and opportunity exists in what we call stand-alone ERs. So those are like mini ERs, not attached to a hospital, based within a community where it has the full range of ER services. So standalone ERs is something that we are seeing more and more of. So for those of you maybe working in a community level ER, that standalone ER may be something that is of interest to you. Medical surgical nurses. I get asked all the time, which is really interesting to me, do you take just med-surg nurses? Well, med-surg nurses, never call yourself just a med-surg nurse. You are the backbone of nursing. We have more medical surgical jobs than any other area. So everybody needs a great med-surg nurse. We need you. Whether that is gastro, whether it's neuro, whether it's orthopedics, whether it's a really good general medical surgical floor, any of those subspecialties within medical surgical, we need all of them here in the US. So please never just say you are just a med-surg nurse, okay? Telemetry, cardiac disease, one of the biggest diagnoses here in the US. So those of you working in coronary care units, working on telemetry floors, working in cardiac floors, we need you. Joyce, I saw your comment. You've wanted to come to the US your whole life. Well, that is amazing. Debbie, your whole life. Well, maybe now is the time to make that dream of your whole life become a reality. That's amazing. Really fantastic to hear that. Okay, let's talk now about home health. So home health, as I've said, if you're working in home health, if you have interest in home health, we definitely have that opportunity, and many companies do. So, Okoye, how is culture shock handled for international nurses? That is a great question. Culture shock is something that you will definitely, without a doubt, 100% experience when you come to the US. I moved from London to New Zealand. I had culture shock. I moved from New Zealand to the US. I had culture shock again. And there are many programs, many companies offer opportunities to help you with that culture shock. One of the biggest things is to understand that it is going to happen, and then to embrace that, and to ensure that the employer that you choose has resources in place to help with those symptoms. Culture shock can be very mild sometimes. Maybe it's just like, oh my gosh, walking into the supermarket and there's 150 different types of cereal, right? That could be really overwhelming for some people. For some people, culture shock can have mental health consequences, and so you need to ensure that the employer that you work with, you are convinced can assist you if you are going through a more severe bout of culture shock. But it is going to happen, so great question. What about nurses working in theater? Well, theater is not a word that you hear really in the US, and I know clients always get a giggle out of nurses saying, I work in the theater. It always makes you sound like you're on the stage, right? Which really kind of you are in the OR, right? But absolutely, theater equals OR, operating room here in the US, and most definitely psychiatry. Yes, we need psychiatric nurses. There are many, many opportunities throughout the United States for nurses who have great psychiatric experience. GI nurses, yes. Gastrointestinal, absolutely. One of those subsets of medical surgical that we definitely have need for here throughout the US. Okay, let me see if there's any other questions on specialties. Let me look and see. Oh, dialysis, yes. So dialysis, absolutely. Right now, we do have dialysis positions, but as you will appreciate, we don't maybe have as many dialysis openings as we do for those more general areas of nursing. So right now, for dialysis, Avant certainly requires that you've already completed your NCLEX. But that may change. We are seeing dialysis, renal failure, unfortunately, due to comorbidities with diabetes particularly, is very prevalent here in the United States. We don't have the healthiest of lifestyles always, and so diabetes leading to renal disease is something that we see quite a lot of. And so dialysis, we anticipate, will continue to grow. But yes, absolutely, dialysis openings. All right, so let's go forward to the next thing to talk about. So what are clients looking for, and what is the benefit to you of working in different facilities? When you come to the US, some of you are going to want to work in a more community setting, in maybe a smaller facility, because that's going to be comfort level for you. Maybe that's what you understand and that's your background. And some of you are going to be looking for that big tertiary level acute care facility. So there's not really any good or bad, honestly. If you have experience now in a smaller facility and you believe maybe you need to go and get more case diversity, I would certainly recommend that you look at seeing if you can move to a different facility. But many of those smaller facilities where you're working now give you great experience. Sometimes in a smaller facility, you have to see more diversity. You're dealing with anything and everything that walks in the door. And so sometimes I find it interesting that nurses who are working in smaller facilities maybe think their experience is not as valuable. Well, let me tell you, that's not the case. Those of you working maybe in smaller community facilities, you are still getting super valuable experience. You become very flexible. You become very skilled because you're working in lots of different areas. And again, you never know what's going to walk in the door. It could be a traffic accident. It could be a woman having a baby. It could be a child who's maybe had a burn. You just don't necessarily know what you're going to deal with. So it really is a matter of preference. Benefits of working in a smaller setting here are often they're in communities. Those communities can adopt you. Many smaller hospitals are so excited to have international nurses working with them. They maybe never have had a nurse from Kenya or the UK or anywhere like that. And so it often is a really wonderful experience, not only for the hospital, but also for the nurse concerned. Also, those of you working in larger tertiary level facilities, that hustle and bustle and busyness, great, fantastic experience to come with. There are such a gambit of hospitals across the US. Larger facilities give you access to even more case diversity when you come. Larger procedures, more varied procedures, more equipment sometimes, more education sometimes. Not always, but those are some of the differences between working in those smaller facilities versus those larger facilities. The most important thing is know your preference. Think about it. Do your research. Think about what is going to help you be the most successful. And find an agency to partner with who has your success in the forefront of what it is they are doing. Okay? Find an agency who's going to make sure you get good preceptoring, who's going to make sure that you get great orientation. Nobody should expect you to leave your home and come into the US and know everything straight away. You're going to need preceptoring. You're going to need orientation. And so make sure the company that you travel with provides that. Okay, let's take a little bit of a look at questions. Nurses from the Philippines, Kimberly Mondala, welcome. Great to have you guys here. Australian NCLEX, yes, that's a relatively new thing. And we are happy to say that the Australian NCLEX certainly is equivalent to the US NCLEX. So that is something that you don't have to retake the US NCLEX. NCLEX is NCLEX, Australian or otherwise, okay? So any help with NCLEX? Yes, you definitely need to look for a company who is going to provide you with NCLEX opportunities for review and support. So that is definitely something you need to look at. How do you find a good agency? Well, that's kind of what we're covering now. Making sure that the agency is going to help you with those things like culture shock, those things like NCLEX, those things with finding you a placement that meets your skill set, those opportunities, those companies that are going to ensure that you get great orientation, that you get to work with a hospital who values the opportunity of having you work with them. So let's talk a little bit about the opportunities of working in home health. Might be new for some of you. Maybe you're working in medical surgical and you're thinking, maybe I would like home health. Well, what are the benefits of working in home health? Autonomy. You are managing your day. It is you, your car, and your patients. So for those of you maybe who are feeling a little burnt out from working in a hospital setting, home health can be invigorating and can revitalize your passion for nursing. You get that one-on-one time with your patients. One of the things I loved about oncology was that I really got to know the patient and their family. And that is the same in home health, that you really invest in your patient. You are intimately involved in their life, you're intimately involved in their healthcare decisions, and you're intimately involved in helping them get well. And so that is something that I think is super rewarding. Flexible scheduling. Yes, you have maybe 4 to 6 patients to see in a day, but that flexible scheduling is up to you. Working with your patients, getting your route figured out, really important that you have flexibility. And so you may need to pick up your kids. You may need to work your schedule around that. And home health, unlike nursing in a hospital, gives you that opportunity. So that's a little bit about home health. So let's talk a little bit now about how do you become a nurse in the States? Well, there is no easy way around it. There is no shortcut. You have to take and pass the NCLEX. So make sure that the company that you choose, that may be Avant, and we have a fantastic NCLEX program, but make sure the company you choose has a fully fledged, well-proven NCLEX program. Now, the NCLEX right now has been changed a little bit. There has been a reduction in the number of questions because of COVID. Spaces for NCLEX across the world have been more limited, so they actually shortened the exam. So now is a really great time to think about doing NCLEX. Remember too that in April of 2023, the NCLEX is going to change entirely. It is going to move from a multiple choice exam to a more focused critical thinking scenario-based examination. So if you are thinking about coming to the US, think about it now. I'm not saying the new NCLEX is going to be harder. Some of you may prefer that scenario style, but right now is a great time to get ready for NCLEX. So find a company like Avant with a fully comprehensive NCLEX program of support. So let's see if there are any questions. Let me just take a moment and scan. Is it automatic to get picked by a company? No, it's not. Most companies will have an interview process. Your experience will be reviewed. Your reasons for coming will be reviewed. Your family dynamic will be reviewed. Most importantly, clinically, are you going to be qualified? So there is an interview and selection process that many companies will go through. So do NCLEX results expire? Well, the good news is no. NCLEX is one and done. So in 99.99% of cases, once you do NCLEX, that is it. You never have to do it again. So that's good news, Emeritus, right? So let's keep moving through. So English preparation, another really important thing that as you're looking for a company that you find a company that can support your preparation for the English exam. Now, not everybody needs to do English. There are some exceptions, but it is based on your country of education. The Philippines, yes. Nigeria, yes, you have to do an English exam, even though we know that many of you speak, and many countries like Ghana and Kenya have English as their primary language, but those countries still are required to undertake an English exam as part of the process to come into the US. New Zealand, the United Kingdom, Australia, those are some of the countries that are exempt. So there are some that need to do it, and there are some countries that don't. The vast majority of countries do still need to do an English language exam. You can take either the academic IELTS or you can take the TOEFL exam. There are scores that you need to gain. In IELTS, you must gain a 6.5 overall and 7 in speaking. In TOEFL, 83 overall and 26 in speaking, right? I get a lot of questions about OET. Right now, several boards in the US consider OET, but CGF&S, which is the main credentialing body for nurses coming into the US, do not accept OET. So even if you have OET, unfortunately right now, you are still going to have to take IELTS or TOEFL. All right, how do you get started with the NCLEX? Well, the most important thing is to make the decision, first of all, on the company that you're going to join. If you want to do NCLEX independently, you can do that, and God bless you if you decide to do that. It is a tough process to get through. Many people do it independently, and I take my hat off to you if you do that. You can go to the NCLEX website, ncsbn.org, if you want more information on taking it independently. My advice, having taken NCLEX, is work with a great company to provide you with support and guidance and structure and motivation to be successful. All right. So how do you find a sponsor? Well, you need a sponsor. You cannot self-sponsor yourself to come in to the United States. You do need to have an employer who can provide you with sponsorship under the green card process. That is permanent residency in the United States. And you do have to have an employer who provides that sponsorship for you. So that again is part of the decision that you make about the company that you are going to join. There are fees involved, particularly if you're bringing family. Every company has a different offering, but make sure you are budgeting and saving for expenses for your families. You've got medicals, you've got flights into the US for your family, but the whole family, married spouse and children under the age of 21 are usually going to be sponsored under that green card process. But again, you need an employer, so ensure that you make a good choice with regards to that employer. So also prepare clinically. You know, we've talked a little bit about that. Know about the differences working in the US. Your employer should be able to provide you with that information. Your employer should provide you with support as you adjust to those differences. Learn about patient and employer expectations. Patients here have a very high expectation of customer service. You're not just going in and doing meds and doing education. You are really the forefront of that hospital's customer service to your clients. So really important you understand that. Understand the scope of practice here in the US. Again, the employer you choose, the company, the program that you research to go with should provide you with all of this information. Okay, so again, super important that you make a great decision about that sponsor. Do you prefer IELTS, George? Do you prefer IELTS before NCLEX? It really depends. How good is your English? You know, many programs require that you have completed IELTS and NCLEX. Many programs don't require you to have done anything because they provide full programs of support. So again, you have to look for the program that works best with the things that you need. Roussel, lovely to see you. Great support. Yes, you're almost here. Roussel is going to be joining us very soon. I know it's been a wait, but we're super excited to see you when you get here. When will the IELTS exam be needed? Well, again, sometimes it's before NCLEX and sometimes it's after NCLEX. It depends on your English competence and depends on the company that you're going to be working with. All right, great question. So preparing culturally, understand the U.S. values and customs. The U.S., like every country, has their own values, their own customs. Learn, educate yourself about that. Ensure, again, the company that you travel with prepares you culturally. Sense of humor here in the States is different. The food is different. We drive on the other side of the road to some of you. Personal values, personal space is different. The way people look at grief, the way people look at healthcare, it varies. So educate yourself. Learn how to drive. Please learn how to drive. If you do two things for me after today, start saving money and learn how to drive, okay? So really important that if you live in New York City, maybe you don't need to know how to drive. But in most other places in the U.S., you do need to know how to drive. So learn how to drive, budget, make those savings, save your money. There are costs. No company can provide every single expense for you. Many programs offer huge financial assistance with NCLEX, immigration, flights into the U.S., assistance when you get here, credit cards, car assistance, but really important that you also are budgeting for your own money and your savings as well. When you come into the US, also find a company that's going to help you secure housing and a vehicle. You need a car when you come here, and you may need two cars. If you're husband and wife, you're both going to be working, you may need two cars. So make sure that the company you choose is going to have opportunities to help you find suitable housing and find suitable vehicles. Just looking at a question, Mia, can I use academic IELTS with UK VI in the US? Yes, you can. As long as you have that 6.5 overall and 7 in speaking, then I just saw a comment that made me giggle, sorry. Then you are in good shape. George, I'm sorry you postponed your marriage. Maybe that's a good thing. I'm sorry that made you do that. But, you know, it's worth investing in a career, great way to enter a marriage with a solid career and solid career prospects. So I hope we get to come to the wedding, maybe. You never know, right? All right, so how to find an ethical agency, really important. And it is my wish and my desire that all of you find an agency that meets your needs. So you want to find somebody where there's no placement or recruitment fees. There are scammers out there, unfortunately. I had somebody Facebook me the other day and say, does Avant charge a fee of $175 for placement? Absolutely not. And you want to find companies who there is no upfront fee. Ethical companies do not charge for application fees. Now, that doesn't mean there will not be and may not be costs within the program, but there should not be placement fees, okay, and there should not be application fees. Joint Commission International accredited, we would definitely recommend that you look for companies that have accreditation with the Joint Commission. That means that the Joint Commission has looked at their internal processes and they have assessed the quality of the programs, the documentation and the support that those companies have provided. Be a member of the American Association of International Healthcare Recruiters. AAIHR is a body that looks at ethical nursing practices, not unlike the CGF&S Alliance, another great resource for nurses looking for ethical recruitment companies. So watch out for that. Nurse-led organizations, our president, past and current, both registered nurses. Really important that if you are recruiting and working with nurses and other medical healthcare professionals, that you understand what it's like to be a registered nurse, what it's like to be a physical or an occupational therapist. Certainly at Avant, we have healthcare professionals in all of those areas, and many of the great companies have nurse-led organizations. Look for awards, look for affiliations. Are they affiliated with certain hospitals? Have they received awards for their programs? Have they published articles? Have they, how do they present in the media? So make sure, again, that's part of that research that is so important. Make sure that they have experience. There's lots of new companies popping up. And if you've been a company that's been in business for 6 months, when the entire process of coming to the US can take 2 years, how does that company know what to anticipate? How does that company know the process intimately when a company who's been in business for 10, 15, 20 years has done this process over and over again? So look at that years of experience. Comprehensive support, A through Z, or A through Z if you're from the US. It's really important that there is support for you at every single step of the process, through selection, through NCLEX, through immigration, through flying here, through onboarding, through orientation, and through the term of your employment contract. What if you have a great NCLEX program but you have no support when you get here? Somebody just drops you off and leaves you to it. You want that comprehensive support. Even the most independent of you needs that support, and so really look for that comprehensive support program. Structure of the contract. Contracts can be very confusing. Make sure that it is easy to read. Make sure you have time. Don't sign with somebody that says you have to have it back by tomorrow. I interview you today, you got to sign it today. Why? You need time. You need time to review it. You need time to look at it. You need time to have questions answered. So make sure that you understand that contract and don't sign it until you do. I know it's exciting. You get a contract, you want to sign it. Restrain yourself. Read it fully. Ask questions and be prepared to commit to that contract and be confident in what you've signed. You also need great benefits. When you come to the States, you need medical, dental, life insurance, short-term disability, long-term disability, help with car purchases, 401k retirement funds. All of those things need to be part of a comprehensive salary and benefits package. So those are some of the things that I would recommend that you look for to find an ethical nursing and physical and occupational therapy agency. So having said all of that, maybe Avant is the right agency for you. So before we talk about that, let me just check in on questions. I'm seeing a lot of age limits. Is there an age limit? Well, we will consider pretty much all ages. However, I think at some point, there is an age when moving to a new country may not be something that's possible. Retirement age here in the US varies for women and men. And so I would recommend that if you are still currently working bedside, if you have the amount of experience that requiring, I would apply. I would recommend that you apply and look at the options and see if there is a company that can assist you. I've just seen Jeffrey's son swing by. Jeffrey was on our program a couple of years ago and has gone on to great things. So if you have questions about Avant, hit Jeffrey up. He'll probably be able to give you some insight. Jeffrey, lovely to see you. Can you accept without NCLEX exam if she is passing the board exam in the Philippines? So if you have your license in the Philippines or in any country as a nurse and you have that postgraduate experience of 12 months, then certainly the Avant program would love to hear from you. So is Avant the right agency for you? When I flick back to that list and I look at the ethical things that we're looking for, we have no placement fee. We're Joint Commission accredited. We're a member of the AAIHR. We're a nurse-led organization. We have lots of awards and recognizable affiliations. We have been in the industry. I've been here 16 years now. I'm in my 16th year. Company was here 4 years before I joined the company. So do the math, right? We offer a program of A to Z assistance. We have a fair and equitable employment agreement that you get plenty of time to review. And we have a really strong package of benefits. So if that all sounds good to you, then we trust that Avant is the right agency for you. And if you would like to join the program, you can go through and do that. AvantHealthcare.com is our website. You can also, there's the link in the chat. Visit the link and apply now. So let me just take a couple of moments to answer some more questions before we finish up. This has been great to spend time with you. 193 of you watching right now from all over the world. It's just amazing, just in this time of COVID, how much we can be connected through tools like Facebook Live. And it's been really such a pleasure to spend time with you. And we look forward to answering your questions throughout the day. Do you have opportunities for OR nurses from ambulatory clinics? That's probably the one area of OR that is still challenging to find. Many American nurses move into those ambulatory OR settings. So it is not really something that we have a lot of opportunity for. But if you could go and get inpatient OR experience, get more diversity, then absolutely. Endoscopy, we do consider. Cath lab, we do consider those areas. Other opportunities for enrolled assistants. So at the beginning, we talked about the fact that at present right now, CNAs, nursing assistants, patient care assistants does not have a visa classification